just as a preface to the presentation, I thought it would be useful just to ask everybody to be mindful of their sources of information. There's a lot of information available on COVID. There's a lot of information available on COVID and hair. So I did a COVID-19 alopecia and hair, which means that all those terms have to appear in a Google search article, and there were 3.8 million hits on Google. If you give the same message to Google Scholar, which is the more educational Google search engine, then you get just over 3,000. And the difference between those two numbers is clearly that most of the 3 million are not relevant. Quite a lot of information excuse me, is available through blogs and articles in the popular press. So I've put one up there: COVID-19, hair loss identified as a long-term symptom of coronavirus, with women most at risk, study says. Well, what you've got to do is you've got to ask yourself, is the source relevant? Is it scientific? And in this case, the subject was, the study was published in The Lancet, which is a really good medical journal. And it said that fatigue, shortness of breath, dizziness, and joint pain were primary long-term symptoms of coronavirus infection. But clearly, the picture illustrates that hair is the one that probably people are most worried about. So social media posts that don't reference a peer-reviewed article. Medium quality, then you get into blogs and articles, or by dermatological societies, so things like the association at the American Academy of Dermatology, and that link. And then you get into peer-reviewed publications, and we've referred to mainly these in our presentation. So if you'd like to move on, what I'm going to do is just to give everybody a refresher on the basics of the hair growth cycle. Clearly, when the hair follicle sheds a hair, something's changed. And when you shed too many hairs, then there's been an upset in the cycle. So just to remind everybody that the hair follicle itself goes through stages: anogen, catagen, and telogen. In anogen, you're producing the hair, and that can last for several years, 2 to 5. You've got a period of regression when the follicle goes through catagen, and then it produces a club hair, which is the hair you find in your comb and your brush, and that comes out with a process called exogen once the telogen follicle's formed. So that's the normal cycle, and the exogen process can happen at the end of telogen, or during early anogen, or even during anogen. The club hair formation process takes about 3 months, which is why you hear the kind of standard 3 months. It takes 3 months for your hair to fall out after it stops growing. So if there's disruption to the cycle, more follicles pass through to catagen and telogen prematurely, and that causes visible shedding. So instead of you losing 100 hairs per day, perhaps you might be losing 500 up to 1,200, and that can be very, very worrying. So if you just move into the next slide. So now we thought we'd introduce you to the basics just of COVID-19, again, just so that we've got the basics out of the way. So, Ian, are you doing this, or do you want me to?
There's not many people who would want this to happen. No one's going to turn up and go, do you know
sorry,
what?
Everything's going wrong. Sorry. So, an overview of COVID-19. So we know that it's a respiratory illness. I mean, this is. It doesn't really bear saying because everybody knows about it. But just to recap, the virus is called coronavirus because it has corona spikes on it. It's a novel virus. It was discovered in Wuhan, China. and novel means it's new. It means humans have no prior immunity to it, which is why it's been so devastating around the world, because it doesn't seem to have any basis in nature. Do you want to just move on one? We know that the most common symptoms are a fever, a cough, tiredness, loss of smell, and we'll come back to the fever, which is probably the most important point that we're going to make tonight. The less common symptoms: sore throat, headache, aches and pains, red, irritated eyes, diarrhea, rashes, which again are an important factor where we're concerned. And there's also long COVID, which is to do with the effects which last more than 3 weeks after you've had COVID. So these are becoming obviously more of a prevalence now that people are moving away from the acute phase of COVID and going into what happens to the body over a long period of time. But what we're going to concentrate on tonight is the effects to the hair, and we're going to probably concentrate on the fever part of it mostly, because that's what affects the hair cycle the most. So if we want to just move on.
So if you move on, so I'm going to talk about the link. So going back to the hair cycle again, an illness, a febrile illness, is one that has an effect on the hair. It's been known for years that if people have a fever, could experience a shedding event sometime down the road. Now, if you remember, I said earlier that the hair takes about 3 months in telogen before it kind of falls out. Well, people often forget that they've had a fever and then they experience hair loss, and they don't relate it back the 3 months to that fever because they think it's something that happened today or yesterday. So we call that kind of rapid hair shedding acute telogen effluvium. So that's what you'll hear it referred to. Occasionally, people can lose the hair during the anagen stage of the cycle. Mentioned here, chronic illness, stress, anxiety, etc. And the febrile illness, the fever related, is the one that is probably the most important for COVID. When you grasp some hairs, if you pull really hard, you pull the anagen ones out and the telogen ones. And in the top panel, you can see from the left, you can see anagen, you can see a telogen hair, and then you can see what's considered to be a catagen hair. It's got slightly more material around the base of the hair. And then you've got, in the next one, you've got an anagen follicle that's been pulled out, and it shouldn't have been pulled out, and that's called dysplastic hair. And then you've got a cut hair or a broken hair and a dystrophic hair. And the dystrophic ones are where you often see where people have, for instance, in chemotherapy. Clinically, the hair pull test, which is shown in the little photograph, is where you grasp a bundle of hairs and gently pull rather than aggressively pulling. And you end up with, if you end up with more than 10% of your sample, you would consider that there's telogen effluvium. And the hairs that come out, if you go to the top right picture, are the ones that look like on the right. The telogen follicle, when it comes out, the club hair has cleanly separated from the telogen follicle. And if the telogen follicle, if you shed the hair before that process is complete, you end up with some material attached to the bottom of the hair. And you can see that on the two pictures shown here. And the hair pull test, and also people collect their hairs, and you can show how much hair you should be losing versus how much you are losing, using an example of a bundle of hairs, which can give you an idea as to whether you're in the normal range or not. So that's how we diagnose telogen effluvium. So when you look inside the skin, this is a transverse section through a biopsy, you can see that the hair follicles sit in groups. And in this image, most of the groups have a big hair in them. You can see the sort of white grey circles are the hair shafts. But with telogen effluvium, maybe 2 or 3 of those follicles will go into telogen, and therefore they will be empty. So there won't be any hair shafting. The follicle is still there though, and that's why it's really important to bear in mind that telogen effluvium is a episodic shedding, and it's when you have a synchrony in the cycle, so you have more hairs exiting anagen than normal. But the follicle will reactivate and you will get a new hair growing. What happens is that on the little diagram on the left, you end up with a disrupted cycle. You end up with a rather larger proportion of the shorter hairs and finer hairs, and fewer long hairs that you would perhaps normally. So you might see a reduction in your ponytail thickness. And on the 2 sort of close-ups of the scalp, you can see that with telogen effluvium, you end up with fewer hairs coming out of each hair follicle in the skin, and sometimes there aren't any. And you can see that with in telogen effluvium, you end up with some of those groups of hairs lose all their hairs. Then this is somebody who's had a shedding event, and you can see on the left with the arrow and the line that the original hair that was long is much less dense than the hair that's growing through, and you end up with a bit of an underthatch. So people can quite readily see that everything's going back to normal if they can feel those short hairs reappearing sometime after 3 or 4 months.
So moving on now, looking at, can genetic hair loss be a potential marker in COVID-19 illness severity? And this is something that's been spoken about quite a lot. We're talking obviously about male and female pattern hair loss, also known as androgenetic alopecia. And these are conditions which are linked to androgen sensitivity. So hair follicles, obviously in the familiar top region of the scalp, have an increased sensitivity to androgens, male hormones. So what's been suggested is that there's a possible link between this androgen sensitivity and severe illness in COVID-19. And what's been found and what's being illustrated here is that the androgen receptor regulates the transcription of the transmembrane protease serine 2, which is required for COVID-19 infection. And this primes the spike protein, and then this facilitates entry of the virus into the cells, and that's one of the reasons why the link has been suggested. So the Gabrin sign. So Dr. Frank Gabrin was the first American physician to unfortunately die of COVID-19, but he did suffer from androgenetic alopecia, and he was also a survivor of bilateral testicular cancer as well. So one of the places that this theory came from initially was that it was noted that there was increased mortality in males, and of course lower incidence of COVID-19 in children. Also, obviously, we're quite aware that there's differences in mortality rates according to ethnicity, and it's noted that there are some racial variations in some androgen mediated conditions. So for example, African American men are at higher risk of aggressive prostate cancer. So androgen sensitivity, and obviously we're talking again back to male female pattern hair loss, are determined by genetic variants in the androgen receptor. And obviously in terms of hair loss, this is relevant in male pattern hair loss, of course, also polycystic ovarian syndrome, which can also be associated with female pattern hair loss. And as we were saying just now, the androgen receptor regulates the transcription of this enzyme, and this is also expressed in organs that we know are targets for COVID-19. So as a result of this, anti-androgens and androgen mediating drugs have been proposed as treatments for COVID-19, but this work is still ongoing, so that we haven't got final information on this as yet. So what we're looking at here, this was a retrospective study. So this was looking at data that had previously been gathered as part of the UK Biobank, and where a detailed medical history was collected between the years of 2006-2010. The hair loss was self-reported using image Hamilton-Norwood scale. And then these same people were later contacted, and some data was analysed looking at testing positive for COVID-19, the percentages, and this was then related to the severity of the hair loss. Obviously, there are some limitations, and this very much being aware that this association, as it says there, does not prove causality, but it's interesting there that there appears to be a link. But it has to be said that there has also been suggestion that association with severity of hair loss and severity of COVID, some people report that there's actually no difference in rates of androgenetic alopecia amongst COVID-19 sufferers to the general population. So, we're not totally sure, but we believe that there is an association with the androgen receptor. So this is really just a hypothesis, but I thought it was quite an interesting image, particularly with the scale along the bottom, and just looking at who might be regarded as less androgen sensitive on a scale, going up to those who may be more sensitive to androgens. And really, this is just looking at the relationship between the viral load and the symptoms of COVID-19 and androgen receptor activity. But certainly, there's still a lot more work to do on this. So this is partly picking up on what Jill was talking about, the post-COVID hair shedding, the telogen effluvium. But interestingly, also, this lady appears to be suffering also from androgenetic alopecia. So what we can see here is that where she's suffered from increased hair shedding 4 months after the confirmed COVID-19 infection, we can see a quite noticeable difference in the density of her hair. Her scalp is quite a lot more visible in the central image. And then obviously it recovers on the right, but we can see that with the image in the center, it has also made her androgenetic alopecia a bit more apparent, but just illustrating in this image that it does generally recover very well. And what Jill was talking about, those follicles are still there, but there's a disruption in the hair cycle.
We're going to talk about the role of the immune system in COVID-19 and hair loss. So obviously we've heard from Jill about telogen effluvium is really the key part of hair loss that we come across, but it's interesting to kind of look at the other effects as well. So when we think about viruses and the immune system, viruses enter the body and they're incorporated into host cells, so they can't exist on their own. And from that point, the immune system is activated and it releases various cells and antibodies that destroy those infected cells. So that's kind of what should happen. However, viruses, they can evade that. They can mutate, which makes them harder for the immune system to target. But also in some people, the immune system might be slower. It might not work as well. So there's certain things that will contribute to those risk factors. But what happens next, the issue with COVID, you might have heard this mentioned, this cytokine storm, is that the immune response is kind of dysregulated and there's this hyperactivation of inflammatory cells, and it causes a huge amount of damage in the body. So when we look at those kind of risk factors for why people get more severe COVID reactions, there's a number of ways that the immune system is altered in these particular areas where there's a kind of impaired function already, or a kind of senescence of the immune system. So the immune system doesn't work as it should do. It's not quite as active as it once was, maybe. So these are quite well-defined risk factors. However, when looking for the evidence for this, I came across one study that looked at all of these risk factors and also discovered that within their questionnaire responses of confirmed cases of COVID, that alopecia and grey hair were also among them. So as we can see, there may be something about androgenetic alopecia that could be a risk factor here. However, within this study, the term alopecia was very ambiguous. Alopecia literally means hair loss. So you can't really use that strong evidence to say alopecia as a risk factor because there's many different types. But grey hair, I would argue that it's associated with aging rather than an independent risk factor on its own. So kind of slightly interesting to look at, as Jill was saying at the beginning, the sources of evidence and kind of how they come to these conclusions and what's associated or what the relationships are between those risk factors themselves. In autoimmune conditions, autoimmune means the immune system is attacking the self, so auto means self. So with these effects of a hyperactive immune system that we see in COVID, then it would be interesting to think if there was an actual increase in autoimmune hair loss during this time. So alopecia areata is an inflammatory autoimmune condition that affects the hair follicle. So the hair follicle is usually hidden from view, and in this type of condition, an autoimmune condition, the hair follicle is actually targeted by the cells of the immune system, and that's what makes the hair fall out for varying periods of time, and it causes varying kind of progression between different patches, larger patches, extension across the whole scalp and the body, and it can spontaneously recover all on its own as well. So there are immune system factors contributing to this clearly, but there's also stress associated with it. So when we think about COVID, the pandemic, that kind of thing, stress is also a big part of that. So that's a kind of another interesting take on it. And for those of you who are practitioners out there, we would love to hear from you if you have seen any increase in any new cases or relapses in cases, because there's no evidence of any increase in new cases that I could find at the moment. Perhaps this evidence is going to be coming in the future. There was one study looking at the rate of relapse in alopecia areata, however, in Italy, and there was a significant increase in the number of the amount of relapse in confirmed COVID cases compared to the relapse in people who hadn't had COVID. So it'd be really interesting to see if this is a factor, if COVID-19 is a factor in this. So there are other types of autoimmune conditions that can affect the hair. These are permanent scarring conditions. So they're slightly different to the alopecia areata, but again, there's still no evidence that exists on kind of these causing an increased severity in COVID, or vice versa, that COVID causes these. So it'd be really interesting to see the results of prospective studies looking at this, if that hyperactivity can contribute to the onset of these in the future. When we think about vitamin D, it's actually a fat-soluble vitamin. It's obtained minimally from the diet, and mainly it's obtained from the sun. It's inactive and it needs to be activated within the body. So the final functional product is created within the body. So calling it a vitamin is slightly a misnomer there. The main function is to maintain calcium balance for bones and muscle contractions. It also has an effect on cell differentiation and proliferation, which is important in a moment. Vitamin D can regulate the immune system. So there is a vitamin D receptor on various immune cells, and that can help to alter or suppress their activity. And there are several studies that have found a positive association between a higher risk of COVID-19 infection when you have a vitamin D deficiency, and also the severity of that illness. However, there are other groups who have also found no association between the two. So if you're vitamin D deficient, then it would probably be good to take some vitamin D just in case. So vitamin D and the hair then. So we know that vitamin D kind of modulates hair growth and differentiation, not only in the hair follicle, but also in the skin. So there's a vitamin D receptor here. So one of the functions, as I mentioned, that vitamin D can change how cells grow, and there's kind of cellular differentiation. In mouse models, the activity of the vitamin D receptor has actually been found to be highest in anagen, which is the growing phase, which is really intriguing. So for those who have a genetic defect in their vitamin D receptor, then we see alopecia. So we know it's really important in hair growth, but the level of evidence in relationship to alopecia areata, Telogen Effluvium and androgenetic alopecia, there is some, but it does vary in the quality of it. There's no link at the moment that's been identified between the severity of vitamin D deficiency, COVID-19, and then the severity of hair loss specifically. So again, that would be a really good thing to look at perhaps in future. So for those of you who are taking vitamin D, I just would like to finish with make sure that you either check your dose or check your vitamin D level. Vitamin D is actually stored in the body, and too much of it can lead to problems with too much calcium in circulation, and that can lead to more health concerns. So it's not something to be taking high doses of off the shelf if you don't need it.
Is there a connection between COVID-19 and skin reactions? There are several reactions, skin reactions, which have been documented, not just because of COVID-19 itself, but also vaccine reactions. So we have different variations, and this is going into more dermatology than trichology. So we're just going to touch on this: urticaria and delayed large focal reactions. So this is sort of from edema. So probably the takeaway message from this part of it is, what do you mean by a scalp sensitivity? Because there is a sensitive skin, there is sensitization, and there is a sensitivity to products. So you've got to differentiate. So when people are looking at using hair dyes or think that they're going to have a reaction to hair dyes because of a previous COVID-19 response or to the vaccine, are you looking at which one are you looking at? Sensitivity, sensitization, or sensitivity to the scalp? We usually find that the skin sensitization is more to do with hair dyes than sensitivity to the products. So that is, the sensitivity to products is more to do with harsh detergents and the perfumes. What we've found is, or what they tends to look like, is that people have dyed their hair more themselves. They've used different types of products. They may not have followed instructions, so you have more of these reactions, and potentially they have sensitized themselves to PPD whilst in lockdown. So there is no particular reaction, or there's no particular connection between COVID-19 and people having more hair dye reactions, but we do know that there has been sensitivity effects whilst having COVID, and there is a large area of skin problems which occurred during COVID-19. Skin sensitization can occur at any point, and there's no evidence of increased sensitization following the COVID-19 or the vaccine report. Obviously, we do ask you to abide by the manufacturer's instructions, which is usually if there's no color being applied for over 6 months, if there is another color brand or a different coloring product which includes a different shade, you should patch test for 48 or 72 hours and make sure that there is no reaction. Bearing in mind that you can sensitize a person with a patch test, so please be careful when you're dealing with people who've had COVID-19 and are just about to start having their hair dyed again.
So yes, just looking at the socio-psychological effects of COVID-19 and lockdown. So this might be helpful, obviously, for trichologists in practice, also hairdressers, you're speaking to your clients. I know I'm certainly starting to see a lot of patients that I haven't seen since pre-pandemic, and the conversation always comes up, you know, how has the last year been for you? And it's noticeable that the impact on people is quite variable. So, you know, obviously there's, as we might expect, there's a lot of potential negative impacts, obviously financial implications. Many people have lost their livelihoods, employment, obviously mortality, bereavement, food considerations, social contact. Obviously that's been a big one, effect on mood and mental health, and obviously family and children, and, you know, homeschooling, all of those additional challenges. But it also has to be said, for some people there have been positive effects. They have had more time as a family, less social expectation, or that expectation to be out and socializing maybe when they don't always want to, time to eat better. I've had a lot of people say that, you know, the restaurants were shut, you couldn't eat out all the time, a slower pace of life, more sleep, definitely, more time for hobbies, more, you know, running, walking. That's all we could do, is go for a walk every day. So the experience, I think, has been noticeably, you know, different for different people. So just looking specifically at the effects on the hair, I think there's some quite important practical considerations when if somebody particularly is coming to a trichologist and talking about hair falling out more. Of course, we couldn't get our hair cut, the hairdressers were shut, and the practical knock-on effect of this is that the hairs are longer. Now, if you consider that on a daily basis you can lose as many as 80 to 100 strands, if you consider then you've got even up to a year's worth of growth. I've had people who haven't had their hair cut in a year, that's 6 inches more hair. You think you times that by 100 on a daily basis, that's going to look a hell of a lot more in the plug hole. Reduced frequency of washing, again, I've had a lot of people say to me, well, I'm not going to work, I'm not stretching out the time in between washes a bit, but then the knock-on effect of that is that there's an accumulation. So as trichologists, when we're looking at hair shedding, when we're assessing the amount of hair that somebody's losing in an examination, one of the most important questions is, when did you last wash your hair? If you washed your hair that morning, there could be a very different assessment of the hair shedding versus if they'd washed their hair a week ago. Obviously, some dead hair is dislodged day to day as you're going about your life, but most dead hair, or a lot of dead hair, is dislodged when you shampoo. So that's a really important consideration. So somebody may perceive that they're losing more hair, and actually they're not, they've just cut down their frequency of washing. Fewer distractions, more focus on the hair, that's definitely a big one. Again, a lot of people have said to me, they've seen their hair on Zoom and suddenly they notice, we're faced with our image on a daily basis, like we are now on a screen, in a way that we never were before, and that for some people has really brought into focus how they perceive their hair. So less concern about appearance as not going out. I mean, that obviously could go either way, but one of the effects of that is potentially less heat used on the hair, less blow drying, so obviously that could have a positive effect on the hair condition. Disruption of routines, again, so this could be a contributing factor in hair shedding. So obviously people haven't had their normal day-to-day schedules, so sometimes they forget to take their supplements as they would in the mornings, or medications, and then this could in time have an effect on the hair. And then just finishing here on a study that was done, obviously just a very small study, but it was looking at women who were already suffering from Telogen Effluvium, and they were all reporting that the condition had got worse during the lockdown period. But an assessment was carried out, which is called a modified wash test, where hair is washed on a series of consecutive days and shedding is assessed. And it was actually found that in 56% of these patients, they were not actually shedding more hair. So it's an interesting one about perception there.